Welcome to the Probate Nation. My name is Richard Ruddy. Tonight we will learn more about the not-so-secret but often misunderstood do's and don'ts in selecting Medicare, Medigap, and Medicare Advantage plans. Reminds me of the story about a priest who is greeting his parishioners after Christmas Mass. He sees one parishioner and pulls him aside and says, "I haven't seen you in a while. You need to join the Lord's army." The parishioner responds, "I am in the Lord's army," to which the priest says, "But then why don't I see you on other Sundays other than just on Christmas and Easter?" And the parishioner responds, "Well, I'm in the secret service." Well, there are no secrets in the Medicare information available to everyone, just a mass of nitty-gritty detail that's often misunderstood. Our show tonight will touch on many of those details, including Medicare and Medicare Advantage plan changes you can and cannot make, how to find the best Medigap, Medicare Advantage, and Part D prescription drug plan, and much more. But let me introduce our guest. We're pleased to have returning as our guest, Emily Gang, president of the Medicare Coach. Her firm provides independent advice to seniors and their advisors on how to get the most out of their Medicare coverage. She also runs a Medicare enrollment concierge service that educates on Medicare options, pitfalls to avoid, and tips on key decisions that need to be made. She's a graduate of University of Kansas, and prior to joining the Medicare Coach, she worked as a risk manager for Goldman Sachs. Please welcome back Emily Gang, president of the Medicare Coach. Hi, Emily. Thanks for coming back.
Hi, Richard. Thanks for having me.
Oh, it's our pleasure. So let's just jump right into this because we have a lot to cover. Can you give our viewers a brief overview of what we covered last week in Medicare in the Part 1 program?
Absolutely. So we began by what is Medicare. And Medicare is mainly Medicare Part A as well as Medicare Part B. So Medicare Part A is mainly your inpatient hospital coverage, while Medicare Part B covers most of your medical expenses. We talked about the fact that Medicare is not free, while most people will get Medicare Part A free because yet you have your 40 quarters paying into your FICA taxes, but Medicare Part B is not free. Also, Medicare Part B does not cover everything. And for that reason, we have other parts of Medicare to kind of complete your health insurance coverage, which includes your Medicare Part D drug coverage, which covers all prescription, or covers at least most prescription medications. We have Medigap plans, which help cover the expenses, the 20% mainly, that Medicare does not cover. And we also have Medicare Advantage, which is oftentimes called Medicare Part C, as in Charlie.
Well, this sounds like too many decisions for me. And frankly, I thought Obamacare got rid of all these decisions and made my life easier. Is that not true?
Yeah, not necessarily. There's a lot of confusion when it comes to Medicare because people will say, well, I'm just going to pick whatever Medicare plan that's cheapest or whatever it might be. But the reality is there's a couple of different programs to pick from. And some of these programs have certain guarantee issuance rules. So, Richard, people oftentimes say, well, didn't Obamacare get rid of the prior authorization, the pre-existing health conditions rules? And the reality is for certain parts of Medicare, including Medicare Advantage, yes, they have to accept you no matter what your pre-existing conditions are. But the reality is, as well as really Medicare Part D as in drug, but those Medigap plans are not required to accept you. But when it comes to Medigap plans, they tend to have a 6-month window when you first join Medicare.
Oh, wow.
That you can do whatever you want. But if you try to join one of those plans after that 6-month window, you oftentimes can't go back because they will ask you for your medical history in most cases, and they are not required to accept you. So it's important to not assume, to your point, that the Obamacare rules apply to Medicare because they are very different programs.
Well, that's really good to know. Now, Medicare and the whole decision-making process we talked about in Part 1 begins to kind of get really focused as we get towards the fourth quarter of every year in what we call the Medicare's annual review period. So what is that period?
Yeah, it's such an important time of year, and I'm glad we brought it up because it's the main time that people can change either their Medicare Part D drug plan or their Medicare Advantage plan. So kind of what happens is that all the plans are announced by October 1st for all the new calendar year, at least for Part D and Medicare Advantage. And then during this October 15th through December 7th period of time, you can change all your Part D as well as your Medicare Advantage plans, no matter what your pre-existing health conditions are.
Well, that's important. So that window, that review period becomes a critical opportunity to do some adjustments if it might be appropriate. That's good to know. Do most people, though, switch plans?
So unfortunately, Kaiser had a study recently that only 29% of people reviewed their Medicare Part D or their Medicare Advantage plan during this time period, which means that too many people are overpaying for Medicare. I mean, last year, over 60% of our clients changed their Medicare plans and on average saved just over $1,300 for the upcoming year. That's a lot of money, especially when you're on a fixed income. So while most people don't change their plan because they assume that if the plan works now, it will work next year, but that's definitely not the case at all. So people should be reviewing plans.
Okay, so the important thing about that then and why people would switch is because they'll get either better coverage for less money or they get the same coverage for less money, which I guess is what you help them figure out going through your 5-step process. So that's really good information to know. Well, let's talk about we're talking about Medigap plans. Can we change our Medigap plan during the annual review period?
I get this question a lot because people just assume based on the ads that they can change all parts of Medicare. But Medigap plans, you are not guaranteed to change in most states during this period of time. And the reason is that Medigap plans have something called guarantee issuance rules. And so when you first join Medicare, again, you can do it every one. I'll cover this in more detail shortly, but we're not guaranteed to change Medigap plans during this period of time. So if you have a Medigap plan right now, please be careful.
Okay. Now, if I'm on traditional Medicare and I want to switch to Medicare Advantage, can I do that?
Absolutely, yes. So during this period of time, you are allowed to change from traditional Medicare back to a Medicare Advantage plan very easily, sometimes almost too easily. But I always just say, please be careful because while it is an option to go between the two, make sure that decision's being made for a very good reason and not just for the advertisements. But yes, from October 15th through December 7th, you are absolutely allowed to change from traditional Medicare back to Medicare Advantage.
And when I do that, is there no underwriting because I have not been in a Medigap plan yet? Or Medicare Advantage plan, I should say?
Yeah, so Medicare Advantage is required no matter what to accept you. So whether you have stage 4 cancer or lung issues, or you're on an inhaler, you have depression medications, Medicare Advantage is required to accept you no matter what, which is the exact opposite of how Medigap plans work.
Now, if I do change to a Medicare Advantage plan and I had a Medigap plan, what happens to that plan? Does it just go away or I have to still pay for it or what?
It unfortunately does go away. And I will tell you, every about February, if not earlier March, we will get calls from people who were on a Medigap plan before this time period. But they saw that they were told more or less that by going to Medicare Advantage, it would save them quite a bit of money because Advantage plans tend to have lower premiums. But this gentleman I'm talking about in particular, when he joined Medicare Advantage, he lost his Medigap plan. And when he called me in February, he wanted that Medigap plan back. And I said, unfortunately, it's too late in his case. So that plan does go away once you join an Advantage plan. So please be careful because you can't necessarily reverse that decision.
And again, we're talking about going back and forth. So let's talk about I'm in a Medicare Advantage plan and I now want to switch back to a traditional Medicare plan. Can I do that?
So while yes, you can technically go back to traditional Medicare from the standpoint of Medicare Part A and B, okay?
Okay.
You can absolutely drop that Advantage plan and original Medicare just kind of becomes your default. You are also absolutely able to get a Medicare Part D drug plan because again, those plans have to accept you no matter what your health conditions are. but that Medigap plan is not required to accept you. If you apply for a new Medigap plan, they're going to ask you for your medical history. They usually go back anywhere from 3 to 5 years. And if there's any red flags at all, they're not going to accept you. We had a client who was very healthy. He's a marathon runner. And he wanted to go back to Medicare, original Medicare with the Medigap. But because he had a kidney stone just a few months before, on that fact alone, they would not accept him, which is crazy because he's probably healthier than I am. But again, they're really particular on those Medigap plans to go back after your 6-month window in most states. So you aren't guaranteed to make those changes in the future.
So the cost of traditional Medicare, how does that compare to the cost of a Medicare Advantage plan? I mean, I know you kind of indicate they tend to be less, but then there's higher deductibles. So tell us a little bit about that.
Yeah, good question. So no matter which path you go down, you're going to again have that cost of Medicare Part A as well as Medicare Part B. Now again, most people pay nothing for Medicare Part A because you meet the requirement, but there is a Medicare Part B cost. So no matter which path you go down, that cost is absolutely identical. So where the differences come is premiums as well as out-of-pocket expenses for the other plans. Now, if you're on original Medicare, again, you're going to have Medicare Part A and B. You're also going to have a Medicare Part D drug plan, and finally a Medigap plan. So Medicare Part D drug plans can be anywhere from $0 a month to over $150 a month. Medigap plans are anywhere from about $20 to $250 a month for most people. What you pay depends on you, but if you're on original Medicare, I usually recommend you budget around $3,000 per year for your medical expenses, plus any medication copays. So that's kind of the original Medicare route when we work with financial planners, kind of budget what the expenses are. On the other hand, with Medicare Advantage, again, you have that same Medicare Part B, but those Medicare Advantage premiums go anywhere from $0 to, again, a couple hundred a month. But the key expense with Medicare Advantage tends to be the copays and more importantly, the maximum out-of-pocket expenses. So those plans tend to be between $4,000 and $10,000 a year for maximum out-of-pocket expenses. So we tend to recommend, Richard, that if you're on Medicare Advantage, you're going to budget between $4,000 and $10,000 a year plus your medication copays.
Okay. Now, if I'm in a Medicare Advantage plan, is it easy to switch to another Medicare Advantage plan?
It is. And we talked about it in the last show, but especially if you're in a nursing facility, really anyone who sees doctors. But oftentimes those networks of doctors, the providers, switch the insurance they accept every year. And so it's really important to understand that you probably should be reviewing your Medicare Advantage plan every year. Even if your doctors don't change, the contract through the insurance company can absolutely change, which will impact who you can see and also the cost that you pay for your medical coverage.
So let's kind of bring this down to a real focus. What are some of the common Medicare coverage selection mistakes that you see on a regular basis?
Oftentimes, people don't realize that their plan is changing. I had a good friend, Paul, who came to me again, it was in February of one year, and he says, Emily, I didn't have you review my plan, or I didn't review my plan myself because it was working so well. And I just assumed that my plan would be just as good next year. Well, by his second trip to the pharmacy, when he paid quite a bit more money for his medications, he realized that was not the situation. So do not assume that your plan will be identical to next year because it's absolutely not usually the case. So that's one big thing. I would also say that doctors, right? People don't realize their doctors can change the type of Medicare that they accept. During this time, we don't usually see doctors drop original Medicare, but we do see doctors change the Advantage plan that they accept. So again, just because your plan works now does not mean that come January 1, it's going to be identical. And for those of you who have, say, primary care doctors or eye doctors or cardiologists or whatever it might be, or even physical therapy, ensure that your Medicare plan is still taken by your doctor for the upcoming year. I also find, Richard, we talked about Medigap plans. And I think the ones that the people who break my heart the most are the people who are calling in because they're on a really tight budget. And they again call me at the beginning of the year in tears because they switched to a Medicare Advantage plan out of this promise to save them money. And that was absolutely a lie for most of them. And so don't assume that the commercials that you're seeing um, or the insurance person's telling you is the absolute truth. Please be careful because again, when you're on a fixed income or really any income, you don't want to overpay for things. And if you're on a fixed income, you don't have that flexibility to pay an extra $5,000 a year for your health care. So again, please be thoughtful around the changes. Your plan will change, your doctors can change, and you might not be able to go back to a Medigap plan, those ones that protect you financially, if you leave it at the first time.
So how do I find if I'm in a Medicare Advantage plan, how do I find the best Medicare Advantage plan?
Yeah, there's really 5 steps that we follow. So the first one is understanding what's most important about you, Richard. So I have a client who was really adamant on having the lowest possible premium. I said, great, that's good to know. I'm probably going to put you into a WellCare Give Back program, which will give you money back, which is the ultimately lowest premium. Okay, but what's your priority? Is it lowest cost? Is it free perks? Is it again your doctors? Is it total overall cost? You're trying to protect yourself financially. What's most important to you? From there, step 2 is understanding what does your doctor accept, right? What type of insurance does your doctor accept? And are they changing? Are they not? And do you want to have the flexibility to go out of the network if you have serious health issues? I mean, I had a herniated disc in my back, and I didn't want to just go to any in-network approved doctor. I wanted to go to the best when it came to my back. And many people are like that, right? Whether it's a knee replacement or a heart surgery or whatever, an oncologist, people tend to want to have a say over the provider that they see when their health is having serious issues. So it's worthwhile to understand the networks that those providers accept. Also, medication coverage is step number 3. Richard, for those people who have, say, generics, it probably doesn't matter when it comes to medications. But if you're on, say, cancer medications or anything that's more expensive than, say, $50 a month, those plans can have huge cost differences. So it's important to understand how that will impact the plan that you pick. Number 4 is, again, overall costs. Premiums, deductibles, max out of pockets, co-pays, that all goes into finding that best plan and finding those extra free perks. I mean, I don't know, Richard, if you've seen the commercials talking about a free gym membership or free vision or free dental or free rides or meals or, again, money back. But those things can impact people's Medicare decisions. And unfortunately, they oftentimes impact them more than they should. But just be aware of how that does impact your best Medicare Advantage plan.
Well, let's talk a little bit about, can you change, we have prescription drug plan, Part D. During the annual review period, can I change my drug plan?
Absolutely, yes. And again, over 60% of our clients changed their Part D drug plan last year.
And how do we decide if you should switch? How do you make that decision?
Yeah, it's about really understanding, again, what are your medications. So the question is, can you save money, Richard, by changing plans? In order to find that best Part D plan, look at things like, again, your medications, your pharmacy, the coupons that are available, and at the end of the day, what's the overall cost between both Part D drug plans as well as pharmacies?
So we're at that point now. Let's just talk about some of the key considerations and some common mistakes that people make. So if someone's helping out a parent, a spouse, a loved one, or maybe you're the guardian of somebody who is an elderly, a loved one, and they're on Medicare, what should they look out for during the annual review period?
Absolutely. So first off, take inventory of what your loved one has. What plan do they currently have? What are they currently paying for that plan? Get all of the current information. And then look to see how that plan is changing for the new year. Are premiums changing? Are they going up or down? Is the medication changing tiers? Is the pharmacy being dropped? Things like that. Also, if they're on Medicare Advantage, are your doctors changing, right? How does that impact their best Medicare decision? And then finally, just understand what your other options are and look out for that best plan. Richard, you could just go through the steps I just covered to find the best Part D as well as Advantage plan that everyone should be doing anyway. And if you follow those simple steps, you can easily help your loved one understand what the best plan is for them for this upcoming year.
So many people, given when the annual review period falls, many people are looking to retire about this time of the year. And so they're facing these types of decisions. What should they be doing as they look at their employer health insurance options?
Absolutely. So number one is, does your employer health insurance plan still meet Medicare rules? So in order to delay Medicare past 65, that employer plan must continue to meet the Medicare rules. So please check that out. And number two, ask yourself, are you better off joining Medicare? Many people will delay their Medicare enrollment because they're scared of Medicare. They're not sure what it's going to cost or how the coverage will be. But oftentimes Medicare can be the better option. I have a client right now who's retiring in April, but we're going to actually have him join Medicare January 1 because he has some surgeries in the first few months. And it'll be much cheaper to have him on Medicare than on his employer plan. So again, we can stagger your retirement date and joining Medicare once you're over 65, but there's important things to look at to, one, make your life easy, and two, to save yourself money.
So it's interesting, your answer to that last question. So if someone has a retiree plan or employer plan or any other health insurance options, should they take action now during this review period with Medicare?
I would say absolutely. And sometimes it's just, again, taking inventory, right? Again, does your employer health insurance plan still meet Medicare rules? Many times companies change their details or their provider every single year for their employer health insurance. So understand, does it still meet Medicare rules? And if it does, fantastic, right? You can delay Medicare for really as long as you want to. But if it doesn't meet Medicare rules, you're going to have to take some action, right? You're going to have to take certain steps to Medicare. Again, retiree plans, if your retiree plan is changing, I have a client who has a retiree plan, but his plan covers his medications so poorly that we still have him on a Medicare Part D drug plan. So understand, again, the pieces of you, and is your retiree or employer health plan really best? Or is it not necessarily the best option for you? Are you better off going on to Medicare?
Well, I think we're reaching that point in time in the show where we have to begin to kind of ask you to kind of pull it all together for us. So I'd like to get your sort of final thoughts, words of advice about, this whole Medicare decision-making process that we've covered over Part 1 and Part 2. Give us some final thoughts, some key things we should take away from both these programs.
Medicare can be fantastic, Richard, if you do what's right and best for you, right? If you understand the rules, if you know how to pick out the right plan. People oftentimes get stuck in the mess of kind of the insurance company noise and unfortunately the lack of help from the government. But Medicare can be great. Just do Medicare right when you first join Medicare. And please review your or your loved one's plan every single review period that happens from October 15th through December 7th. Again, it's so important to have that right Medicare plan to protect your healthcare rights as well as your hard-earned retirement savings.
Well, there's no question about that. Emily, I tell you, it's been just a pleasure to have you on the show again and to go through this very key subject that affects so many people, and especially many of the older adults who we have many people who are acting as conservators and guardians of adult people, and they should know that they have to take a hard look at these decisions as well. Even though they're making the decisions for somebody else, it's their job and they need to really understand this. So I want to thank you again for just providing an excellent introduction and giving us some key points to consider. Great information, a wonderful public service, and we are forever grateful for you taking the time. So thank you.
Thank you, Richard.
You're very, very welcome. Over the course of 2 programs, Emily has given us an excellent primer on Medicare options, from traditional Medicare to Medigap insurance to Part D prescription drug plans to Medicare Advantage Plus and Medicare Advantage plans. Plus, she has dived into gritty decisions that need to be made and highlighted common mistakes to avoid. No one plan is right for everyone, and there are many options to consider, but There are no secrets here. The key concern I draw from these programs is that some Medicare decisions cannot be changed. So I want to stress the importance of consulting with someone familiar with all the Medicare options and who can help you determine which options are best for your situation. You do not want to regret any of your decisions, and more importantly, you don't want to find out that uninsured medical costs all of a sudden take a bite out of your savings. This concludes our show this evening. Just a reminder that replays of this show can be viewed on the Probate Nation website and YouTube channel. And if you want to receive monthly probate tips, please sign up for the free Probate Nation newsletter. Thank you for visiting with us. Until next time, I am Richard Ruddy, and this is the Probate Nation.